Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Pregnancy and oral health. Your smile is important, and for that, your teeth and gums have to be healthy. Today, I, Dr. Anita Chaudhary from the holy city of Kashi, will talk about the importance of oral health. One way to prevent cavities in young children is to improve pregnant women's oral health. Pregnancy may make women more prone to gum diseases and cavities. Oral health is an important part of prenatal care, given that poor oral health during pregnancy can lead to poor health outcomes for the mother and the baby. I want you to be aware that oral health should be an important part of prenatal care and how women, new mothers, will take care of their oral hygiene and their infants' oral hygiene. Pregnancy and gum diseases. Nearly 60 to 75% of pregnant women have gingivitis. It's an early stage of periodontal disease that occurs when the gums become red and swollen and inflamed because of the changing hormones in pregnancy. 1. If gingivitis is not treated, the bone that supports the teeth can be lost and the gums can become infected. Teeth with little bone support can become loose and eventually may be extracted. Periodontitis has also been associated with poor pregnancy outcomes, including preterm birth and low birth weight babies. 2. However, how periodontitis may lead to adverse pregnancy outcomes is not yet completely understood. Pregnancy and dental cavities. Pregnant women may also be at the risk of cavities due to changes in behaviors such as eating habits also. 3. Women who have a lot of cavities, and these cavities have bacteria, and these bacteria can be transmitted from the mothers to the baby after they are delivered. 4. Early contact with these bacteria and to other sugars such as from frequent snacking or taking a bottle to bed can lead to early childhood cavities and the need for extensive dental care at a very, very young age. 1 in 4 women of childbearing age have untreated cavities. 5. Children of mothers who have high levels of untreated cavities or tooth loss are more than 3 times more likely to have cavities as a child. 6. Children with poor oral health status are nearly 3 times more likely to miss school because of dental pain. So, as pregnant mothers, as mothers to be, you have a great responsibility to take care of your oral hygiene and of your next generation as well. Because if you know how to take care of yourself, you will obviously be taking care of your little infants, and when they grow up, they'll also grow up with a healthy oral cavity. Your visit to the dentist is an absolute must. If you have slightest doubt, go and see the dentist. What's the harm? So keep smiling and make sure that you have a healthy cavity. Yes, another very important thing is brushing your teeth. Remember to brush your teeth twice a day. Once in the morning and once before going to bed. Another important thing is flossing. By brushing your teeth in the right technique, you have to brush it straight, not round like this. Make sure that all the food grains, those are there between your teeth, are removed while you're brushing your teeth. And if that doesn't suffice, then flossing is a very good way of removing the little debris that is there between our teeth. So that will make sure that you have a nice, healthy oral hygiene. One important message that I would want to give all my girls. Yes, we don't want to leave footprints on this planet. I am 56 years young, and all the brushes, all the toothbrushes that I've used all these years will be lying somewhere on this planet. But few years back, I started using wooden toothbrushes of bamboo, toothbrushes of neem. And yes, if I can prevent something somewhere, I have done my beginning. So these brushes are available, so you can give a much better world to your next generation. So start using environment friendly toothbrushes. Thank you and